Good morning and welcome to Global Healthcast 30 on March 7, 2023. We bring to you this broadcast once a week on infectious diseases, on vaccines and vaccination, and this is produced by Global Health Press in Singapore. I am Joe Schmitt, and with me is Dr. Melvin Sanicas. Good morning to Switzerland. Good morning, Melvin.
Good morning, Professor Schmidt, and good afternoon or good evening to everyone watching us wherever you are at the moment.
The topics today are, as always, our COVID-19 update. We speak about long-term consequences of COVID, bats and viruses, healthy lifestyle and long COVID, pre-departure testing to reduce SARS-CoV-2 transmission, measles in Germany, dengue in Latin America, and the adult vaccination schedule. As always, we start with the COVID update. And Melvin, this is yours. What do we see this week?
Yes, so for those of you who have been watching our previous Global Health casts, you already know that we start with this COVID epidemiology update from the WHO. And this is a week late. And at the moment, globally, over 4.8 million new cases and over 39,000 deaths were reported in the last week. This is a decrease of 76% and 60% respectively compared to the previous 28 days. And if you look at the figures, it's actually quite easy to see that cases went up briefly in the end of December and in January, and then it went down again, cases and deaths. And most of these are from China. As you can see, the pink bar is Western Pacific region of the WHO that includes China. And on the next slide, we will see the country level in terms of cases. The top 5 countries in terms of cases are the USA, Japan, China, Germany, and Republic of Korea.
Most cases based on a population does not mean highest incidence, right? It just means most cases. And if you travel there, you should be aware that this is an ongoing transmission there. And how about deaths?
Well, in terms of deaths at the country level, the highest numbers can be seen in the US as well, in China, Japan, basically the same countries in the top 3. But for deaths, top 4 and top 5 are Brazil and United Kingdom. So if you notice, in terms of cases, it was Germany and Korea, Republic of Korea, in the previous slide. But in terms of deaths, 4 and 5 are Brazil and the United Kingdom.
Yeah, interesting. Thanks for the update. Related to COVID is, and what we all worry about is the consequences after COVID. And actually, this is on post-acute sequelae of SARS-CoV-2 infection, or PASC, which is a very common term used now. You saw on our introductory slide that there's also the term PCC, long COVID, and post-COVID. And I'm not quite sure which is the best term to be used. I guess the terminology will follow later on. But right now, I use all these terms a little bit interchangeably, as I'm not sure what the best definition might be. In any event, what you see here is, number one, cancer patients, 60% of them suffer from sequelae of COVID after they had survived their cancer and COVID. And I thought my first impression is this is a high number. The number I had in mind with non-cancer patients is 40%, so 20% lower. The difficulty is, as the methods for looking for cases is different, you cannot really say that there is a difference between 40 and 60. You can just say it is very frequent that you see long COVID or COVID sequelae in those who had the infection. There is one other twist to that slide. If the frequency, if the percentage of post-COVID patients is higher in cancer survivors, that means very likely, or it may mean that it's not the immune system that causes post-COVID, but it is the virus itself that causes damage. And the damage caused by the virus results in the sequelae. This is a hypothesis based on this, and certainly it needs better data and better studies. But looking at one slide, you have many different interpretations. It's not only the numbers that you see. You may also be intrigued to think about what causes post-COVID. Melvin, any thoughts from your side? Any ideas how to interpret this?
I think it's good information that we have this, but I would use this like as a baseline. If you have another study that you do maybe 6 months down the road, you could follow up the patients or maybe another cohort of individuals with the same condition, and you could compare. But just looking at this one, it's really quite difficult to make conclusions. Right?
Yeah. Anyway, it's hypothesis raising. You have an interesting paper on bats as a reservoir of viruses.
Yes, so in many respects, bats really represent the perfect reservoir for emerging zoonotic pathogens, right? They often live in large colonies. They can, through flight, travel and disseminate viruses over distances. And they really enjoy remarkable longevity for their body size. And for these reasons, bats really represent a significant potential source of infectious diseases, emerging infectious diseases. And if you look at all these different bats here, I will not be going through all of them, but these are all the different viruses and pathogens that they carry. And we now understand, as you will see in the next slide, the reason why they are able to do this. And this is a study that was done by a group of international researchers looking at stem cells of bats and really seeing how they are able to accommodate a large number of viral sequences, which shows that they have evolved mechanisms to tolerate a large load of viruses compared to other mammals or even other animals in the world. So that is probably the reason why bats are able to really have all these pathogens in their system, and the fact that they can travel, they can fly, and are able to disseminate all these pathogens, make them a dangerous animal.
Actually, so the lesson learned is they not only harbor potentially pathogenic microbes, pathogenic for humans, but they also have them in a high quantity. They have large load of viruses, as it's written here on the slide, right?
Yeah, they are able to tolerate large loads of viruses.
Yeah, and that makes it more simple to transmit these viruses. If you only carry one dangerous virus in your sputum, that is one thing. But if your sputum is loaded with pathogens, transmission is much more likely, right?
Yes, several pathogens, for example, and we can also think about the potential role of bats for these different viruses mixing and combining.
Yeah, that's another twist to this, right? They have these viruses, they have them in high loads, and as they meet and are exposed to more, they may come up with new variants. Very interesting. Very interesting. I have another study on PASC, PCC, long and post-COVID. And here the researchers looked at healthy lifestyle factors prior to the pandemic and risk of post-COVID condition, they say PCC, among participants who reported SARS-CoV-2 infection. And this is all about nurses in a healthy cohort of young women, actually a 5-digit number of subjects participating in this cohort. And researchers looked at body mass index, smoking, diet, alcohol consumption, physical activity, and sleep duration. In a short story, they used different models to look for these risk factors or for these factors to contribute to post-COVID condition, as they say, or PASC, post or long COVID, whatever preferred term you may have. You can only adjust for age, race, and ethnicity and socioeconomic status. You can also look at your health status in principle with underlying diseases, and you can also look at adjusted for other healthy lifestyle factors. In the end, what it comes down to, and I guess the strongest association is with model 1. So let's concentrate on model 1. You see, body mass index is a significant factor in this study that is associated with PCC. And this is quite interesting, right? Smoking, there is a trend, it's not significant. Diet, there is a trend and it's not significant. For alcohol consumption, there is no recommendation. There is, if you drink too much, it's not good. And if you drink too little, it's not good. So if you drink a little bit, I guess this is what is suggested here, 5 to 15 grams a day is already something, right? Then you're best, then you're doing best. With physical activity, there is a trend again. This is more than a trend, actually, in model 1. This is really nice. So you should do physical exercise, and I guess up to a certain amount. This is very positive. And sleep duration, again, there is no, too much is not good, and too little is not good either. So this is there is no trend there. The very interesting one slide I come to in the end is this one. The more factors in your lifestyle that you have that are termed healthy, if you have many of these 5 factors that where you live healthy, a healthy way, the more effective you are protected against post-COVID condition. So this is the interesting thing, and this is what you like to, this is what you want to see in medicine. You want to see a dosing effect. The more you do something, the more of an effect you see. This suggests causality. Still, I have to admit, there are so many confounders in here. People who live a healthy lifestyle are more likely to be vaccinated with a full course of vaccination. They are more likely to wear a mask. They're more, and there's so many factors that causality cannot be seen or assumed from this slide. There is an indication, it is a hypothesis that this may be the case, but we cannot assume causality. In the end, still, personally, I guess 2 hours from now, you will see me in my daily gym again, and I will continue to go to the gym, if at all possible, once a day. I don't smoke. I try to not drink alcohol or not too much alcohol. And yeah, I try my best to have a healthy lifestyle. Melvin, how about you?
No, I think it makes sense, right? The more of these things that you do to try to have a healthy lifestyle, it really improves your health. And it's not just for COVID, right? It's for all the other diseases. So, well, you know, when in doubt, just try to be as healthy as possible, I think.
Yeah. Yeah, actually, you're right. It's a good point. It also prevents myocardial infarction. If your body mass index is okay and if your diet is okay, it helps you in many different ways, right? It's difficult to prove, though. In any event, we stay with SARS-CoV-2, and you found a nice study from the CDC, Melvin.
Yes. So during the period of December 2021, I think, and until the middle of 2022, around June 2022, SARS-CoV-2 testing was required for people, for passengers flying to the US. And so epidemiologists and researchers, they made this study using a mathematical model estimating pre-departure testing effectiveness in really preventing travel-associated transmission of COVID-19. And so what they found out was that among around 3,000 pooled samples collected between March and September in 2022, pre-departure testing requirement was associated with a 52% lower post-arrival SARS-CoV-2 positivity, which means that actually pre-departure testing can reduce SARS-CoV-2 transmission during or after travel by reducing the number of infectious travelers. And I think it's a good study to show that this is something that actually works.
We were discussing this when it came to the recommendation to do pre-departure testing for travelers from China to the United States or Europe. Remember, we discussed this, and this is actually nice evidence to show that this, I mean, the 50% effectiveness is not bad for such a measure. I think this is really, it has an impact. Yeah, very interesting.
It's good science, right? But I think we have to admit that when these things were being discussed in 2021 and 2022, it was always under the impression of some sort of being racist or being, all these other political tones, right? Undertones. But it's actually scientific.
Yeah, actually, it is biological plausibility, right? If you're tested before you depart and then you're positive and you don't travel, that means you cannot infect others. It is very, very reasonable. But now we have the proof, right?
Yeah.
Very nice. I have an additional story on measles in Germany. Actually, it is law in Germany since 2020 that you need to document your measles vaccination status if you are attending kindergarten, school, or medical institution as a child or as an employee. Lack of proof of measles vaccination can result in a 2,500 euro fine. Now, in Wiesbaden, this is where I was born, and it is only 30 kilometers north of where I live right now. You had to document that you had been vaccinated with 2 doses of the measles vaccine by July 31st, 2022. And they found 3,578 persons who had insufficient or no documentation of measles vaccination in the local public health offices. And I think in a population of 280,000, 3,600 people, this is something, right? This is a large number of people. And these are people in high-risk institutions. In a medical institution, like in a hospital, you see cancer patients, and they may die from measles. Or in a kindergarten, there are children who have had a heart transplantation. Actually, my daughter is a kindergarten nurse, and she had such a child in her kindergarten. In any event, at follow-up, 1,128 of 1,178 persons reported full vaccination. 38 had moved, but 1,506 are still missing, and they received an additional reminder to provide their measles vaccination. I found this news in my daily newspaper, and we will keep you posted. I'm very interested if anyone needs to pay the fine, because what happens very often in Germany, you would have to pay the fine, but you get away with it anyway. So I'm not sure if this is implemented, but this is something I will keep you posted on. Melvin, any insights on measles from Switzerland or from any other parts of the world?
Measles, but I think in terms of paying the fine for this, right? It like many rules, I would say, you have all these guidances that if you don't follow it, you have to do this. But in reality, I think implementation is a very, very different issue.
Yeah, it's very often not done. Now we have all about dengue. Why is this so interesting, Melvin? Why do you come up with dengue now?
So dengue, as many of our viewers would know, is a mosquito-borne illness that occurs in tropical and subtropical areas of the world. Mild dengue can cause high fever and flu-like symptoms, but some people can actually have more severe conditions, and some could die. They are the viruses. There are 4 different kinds. Dengue 1, 2, 3, 4. They are spread to people through the bite of an infected mosquito. And this is just to remind people that while COVID-19 is now on its way out of our consciousness because it's not being talked about as much now, and cases are down, deaths are down, other diseases are coming back. For example, dengue. So you see here in Bolivia, they have a public health situation there. In Peru, they have elevated dengue fever nationwide, and this has never happened in the past so many years. And also in other countries, like even in Sudan, I saw a news clip yesterday. I wasn't able to add it here. And also, I saw a news article about German authorities notifying Spain that as many as 6 German citizens were infected with dengue in Ibiza when they went there last week. So I think it's just trying to remind us that there are other diseases, and especially dengue is just trying to come back to the picture now.
Very interesting. We keep you posted on dengue. We will have a special on dengue in the near future. I have a last piece for today on adult immunization. And the CDC just came up with the 2023 recommendations. I think this is very nice. And all of you who are 18 and above, here you can easily see the recommended vaccinations by age. You can assess if you need additional vaccines, depending on your medical condition. You can review the vaccine types, dosing and frequency intervals, and then you can finally review contraindications and precautions for vaccination. This is the link here. I don't press it because then I would go to the website and you would immediately not see it here because the way I set this up here. But in any event, I have here, you see S of age, 19 to 26, 27 to 49, 50 to 64, and above 65. And you see everybody should get 2 or 3 doses of COVID-19, the influenza annual dose. The live attenuated vaccine is recommended for some age groups under 50. Then we have Tdap here. And you see here, it is particularly recommended for each pregnancy at the end of the pregnancy because you want to protect the baby, not the mother, and so on and so forth. So great recommendations and very easily set out by color coding. Again, yellow means everybody should get it in this age group. The purple, pink color here means recommended for adults with an additional risk factor or another indication. And this light blue means you may be eligible, you can think about it, but you can decide with your physician if you should take the vaccine. Go to this website and check for yourself if your vaccination status is up to date. This is the recommendations in the United States of America. Melvin, any views from your side?
Well, I think this is really important. So if you want to be up to date with your vaccination, this is a good tool to check out.
Yeah, and it's very detailed and it's always up to date. This is what I like about the CDC. Many countries in the world don't have timely updates of their vaccination recommendations, but CDC and ACIP are really always very much behind the newest developments. That was our Global Health PASC 30 for today. We talked about the COVID-19 update with the numbers of cases and deaths going down. We saw the peak from China. Now it is gone. We spoke about consequences of PASC in cancer patients, bats as a reservoir of pathogens. We looked at healthy lifestyle factors, how they may reduce consequences of COVID. We showed you that pre-departure testing reduces SARS-CoV-2 transmissions. I spoke about measles documentation in kindergarten and healthcare in Wiesbaden. Many subjects are still not yet vaccinated against measles, although they go and attend these institutions. Melvin showed you that dengue is on the rise in Bolivia, in Peru, Sudan, and in other areas of the world. And I just spoke about the adult vaccination schedule. Thank you for joining us today. But before we leave, Melvin, you have a cartoon in the end.
Yes. So just to remind everyone that, we have ups and downs in our days, and don't let a bad day distract you from all the progress you've made in your life. So.
Yeah, very nice. Thank you very much, Melvin. This was Global Health PASC 30. I am Joe Schmitt, and with me today was Melvin Sanicas. Goodbye, Melvin.
Thank you, and stay safe.